name is Jennifer Rickerby, and I'm a doctoral of nursing practice student at George Mason University. Welcome to our video demonstration, which is an academic exercise to show how cultural competence can be included in patient interactions. The American Nurses Association standards and scope of practice include cultural competence as an element that is essential for caring for patients of all cultural backgrounds. As the United States is becoming more and more diverse, and with our increase in minority population at the year of 2045, the numerical majority will be the minority population. What you're about to see is an example of a nurse not using cultural competence when working with an adolescent in the school setting with a new diabetes type 1 diagnosis. This scenario is a fictitious situation. It does not represent the opinions of myself or the participants.
Hi, can I help you?
I just don't feel well and I think I need to check my blood sugar.
Okay. Oh, well, hold on. I'll do it. I just want to make sure it's done right, okay?
The other nurse let me do it and the healer actually showed me how to do it.
You go to a healer? Have you ever seen an actual doctor?
No.
Have you seen a diabetes nurse educator?
No, I have not. My mom hasn't had time to take me because it's 45 minutes away and she has to work.
Wow, well that's really important. I mean, you really need to tell your mom that she has to take off work for that because this is your health. You just really need to, I don't know why you trust those people. Healers, doctors are the ones with the medical degrees.
Well, she's been taking off a lot of work, so I was in the hospital, so I don't want her to miss more and lose her job because of me.
Well, if she keeps missing more, then, you know, you're going to be in the hospital again. Or if she doesn't miss any more, you'll be in the hospital again. Let's take your blood sugar.
Can I use my right hand? My left hand's a little sore.
We're going to use your left hand. You know, you're just going to have to get used to it. You're diabetic now, so, you know, your hands are always going to be sore. So that's just something you have to get used to, okay? So let me see this hand. Do you know how to clean it right?
Yes.
Okay. Here's a poke.
Ow.
Oh, did that hurt?
Yes.
It happens. Okay. Let's see. Wow, 220? Has it ever been that high?
No, it hasn't.
Wow, that's really high. I can't believe it's even that high. We need to call your mom because that's just too high to be at school. Have you drank anything today? Have you been eating a lot of rice?
I have not.
Are you sure?
Yes.
Because that really is high. Okay, let's call your mom. Are you able to translate? Does she speak Spanish?
She can speak a little English, but she can't miss work again, so I can't go home.
Oh, but you can't be at school with it that high. So we really need to call her. So let's call her, and you're just gonna have to talk on the phone for me, you know, and just tell me what she's saying. And you know, some people speak Spanish here, but not everybody speaks Spanish. So you're the best person to do that.
Okay.
Okay, here you go. Let's call her.
This example demonstrated how patients can be belittled, judged, and even treated in a way that demeans their culture. Overall, it is difficult to watch how the young student who is already not feeling well and may possibly be scared is made to feel even worse. This next video will depict a nurse that takes more time with the patient to discover about their culture. Please watch the transformation and how the patient responds to the nurse.
Hi. What's going on today?
So I just don't really feel well and I think I need to check my blood sugar.
Okay, do you need any help?
My healer actually just showed me a good way to do it.
Oh, great.
But I'm still learning.
Okay, let me watch your technique. So you go ahead and do it yourself. Do you have a specific finger that you're planning on using?
My right hand's kind of sore.
Okay, well it's okay to rotate. So
Okay.
use your left hand or any other fingers. It's good to keep rotating sites and.
Okay, so.
Do you have a machine like this at home?
I do.
Good. It's pretty easy to use. That's a little, huh?
Yeah, a little bit. Okay.
All right, so let's see. Do you know your normal ranges?
I don't.
Okay, so 70 to 120, so we hope it's within that range. actually a little high. It's 220 right now. So do you remember anything that you ate this morning that maybe would have made it come up a little bit higher?
No, just normal breakfast.
Okay, what do you normally eat for breakfast?
Eggs.
Eggs.
And cereal.
Cereal, what kind of cereal?
Frosted Flakes.
Okay, that has a lot of sugar in it, and it could definitely make your blood sugar spike up. And there are other options. We can talk about other options for foods. Okay, has your healer talked to you about counting carbs at all?
No, he said there's some herbs I can take, but my uncle said I shouldn't take any carbs because then I won't need the insulin.
Oh, okay. Well, that's not completely true. Usually doctors will give you a carb to insulin ratio to where you can actually dose yourself based on what you're eating, and you're tracking all of the food you take in. And there's actually lots of apps, there's websites, many ways that you can track it. Since you are a teenager, I'm sure you have a smartphone, so there's lots of apps that you can get and just track it on a daily basis.
Okay, that's useful because I'm actually really confused on what I can and can't eat.
Yeah, and we can always go through that more and help you break it down. But right now, let's call your mom. Can we do that?
Yes, she speaks a little bit of English.
Okay, what language does she speak?
Spanish.
She speaks Spanish. Okay, so I can call an interpreter.
Okay.
And so I will speak with your mom and let her know what's going on through our interpreter. And she will have to come pick you up, unfortunately, because your blood sugar is so high. But then hopefully we can get it under control.
Okay, she gets off of work in 15 minutes, so then we can call her then.
Of course.
Thank you.
No problem. Let's give her a call just to give her a heads up, okay? Let me just call the translator real quick.
This example shows that a nurse takes the time to provide respect, dignity, which opens the door to establish a good relationship with this patient. The patient felt safe to open up about their feelings and was able to admit her knowledge gaps without feeling judged by the nurse.